Hello again, this is Kimberly Isaacs. I wanted to just give you some information about some research that I had done for my research subject. The research subject was producing an AI-powered database that could work to getting different diagnoses and treatments and just information about patients across the U.S. so doctors have a database that they can get into and get the information that they need for whatever diagnosis that they're going to. My focus was oncology because I work in our oncology floor, and I know a lot of the oncologists with certain cancers, because they're rare and they don't come across them very often. It would be beneficial for them to have that information across the country available to them to see if there's other patients anywhere else in the country or the world that has the same symptoms, and what treatments that those doctors and those places are using, and if they're helping. One of the articles that I have talks about that AI would definitely support and improve diagnostic procedures. It would help in patient care and help in getting results of diagnosis and treatments. Of course, in all of the articles that I've talked about, there's certain issues with ethical issues, legality issues, data privacy. You know, there's still those things to worry about when it comes to information systems. There's hacks, there's people out there that, you know, are always going to try to get information that they don't need to have. So those things are some challenges that have to be taken care of and gotten through. One of the other articles said that a medical database that physicians could submit to could help them with diagnostic information and administer suitable therapeutic interventions. And then of course that would help a lot in chronic diseases such as rare cancers and then just cancers in general. But you know, even in chronic health problems like diabetes or CHF or multiple sclerosis, things that are kind of we hear a lot, especially in the medical field, would help anyway with, you know, symptomology, things they're using for treatments, and again, you know, for just general diagnosing. UCLA, actually, they actually are using an AI-powered tool. Their doctors have one that they use only in their facility, but it helps them to detect rare diseases and put them out there so all the docs can share the information between themselves. And then another thing about research on AI databases, the researchers can use the studies for an algorithm, and they can help to predict which patients would receive what treatment. Just a lot of good info. This kind of technology would be very helpful to physicians across the country. The University of San Francisco, they are using AI to transform medicine. They help detect heart problems without any invasive testing, like patients going in and having a cardiac test. I can't even think of what it is right now. It would help them spot illnesses earlier. AI helps to boost image qualities and diagnose traumatic brain injuries better. And then they're also using it to help monitor Parkinson's disease progression. I guess it's something that their patients are using with their phone, probably to input symptomology and things that are helping the family with the progression of the Parkinson's disease in their family member. So these are some of the things that I'm looking at. I still have to do a little more research on it, as far as like how helpful it would be for physicians. Being a nurse for a while, I can see that it would be. I just have to prove it. So thanks for listening.